Breast cancer is characterized by abnormal cells that multiply, forming a tumor. If left untreated, these malignant cells can spread to the rest of the body, so an early diagnosis is essential. Parkview oncologist Dr. Ellen Sved explains how the severity of the diagnosis is determined.
So we look first at the results of the mammogram to look at the size of the cancer and then determine if there's any lymph nodes that look abnormal. And then that would usually lead to a biopsy, either of the mass that we see or the abnormal area on the mammogram, and then the abnormal lymph nodes as well. And so all of those results together, that would put together a stage of the breast cancer.
What questions might be most helpful in taking an active role during treatment?
I think it's always important to ask, what sort of therapies am I going to be a candidate for? What type of surgery do you feel that I would be appropriate for? And then long term, what additional treatments will I need or do I require to help keep the breast cancer away?
When determining how aggressively to treat breast cancer, the oncologist looks to pinpoint the cause of the cancer's growth. For example, a triple negative growth means that the cause is not found in the hormones, estrogen, or progesterone. The oncologist will determine a patient's treatment based on their individual symptoms.
So really, the questions that an oncologist looks at when we're trying to develop the treatment plan for breast cancer is, number one, what are the drivers of the breast cancer? So what targeted therapies do we have to help treat the breast cancer either before or after surgery? And then the next question, what type of surgical approach does the patient and the family want? And then really, are they strong enough for surgery? What other health problems do they have? And then long-term, are there any long-term treatments after surgery that we need to consider to help treat the breast cancer?
After a diagnosis, it is important to remember that at Parkview, a dedicated team will be there for every step of the treatment process.
Here at Parkview, what we try to do is really wrap services around them and support. So nutritional support, social work support, financial support, and then just day-to-day nursing support. Really, our lead person is our nurse skin navigator that helps to kind of maneuver and answer the questions and the needs as they're needed by the patient and their family as they're going through their treatment.
This has been Making the Rounds, brought to you by Parkview Health.